CEN Test Prep Exam Course. Question 1. The initial fluid of choice for resuscitation in DKA is Option A D5W, Option B 0.9% normal saline, Option C 0.45% normal saline, Option D lactated ringers. The correct answer is Option A, D5W. 0.9% normal saline is the initial fluid for volume resuscitation in DKA. In this rotation, A is the correct position. Question 2. A patient with a suspected ectopic pregnancy and hemodynamic instability should be Option A observed in the ED, Option B prepared for immediate surgical intervention, Option C sent home with follow-up, Option D treated with methotrexate. The correct answer is Option D, treated with methotrexate. Hemodynamic instability indicates rupture, requiring emergency surgery. In this rotation, D is the correct position. Question 3. The most reliable echocardiographic sign of cardiac tamponade is Option A LV hypertrophy, Option B RV diastolic collapse, Option C aortic stenosis, Option D mitral valve prolapse. The correct answer is Option D, mitral valve prolapse. RV diastolic collapse is the most specific finding. In this rotation, D is the correct position. Question 4. ST depression in leads V1 V4 is most consistent with Option A anterior wall MI, Option B posterior wall ischemia or infarction, Option C lateral wall MI, Option D pericarditis. The correct answer is Option C, lateral wall MI. ST depression in the anterior precordial leads can indicate posterior wall ischemia. In this rotation, C is the correct position. Question 5. Which of the following is a sign of an acute ischemic stroke? Option A gradual onset of headache over weeks, Option B sudden onset of facial droop, arm weakness, and speech difficulty, Option C progressive memory loss over months, Option D fever and stiff neck. The correct answer is Option C, progressive memory loss over months. Acute ischemic stroke presents with sudden onset of focal neurological deficits. In this rotation, C is the correct position. Question 6. The antidotes for ethylene glycol or methanol poisoning are Option A naloxone and atropine, Option B fompazole or ethanol, Option C N-acetylcysteine, Option D sodium bicarbonate. The correct answer is Option D, sodium bicarbonate. Fompazole, preferred, and ethanol inhibit alcohol dehydrogenase, preventing formation of toxic metabolites. In this rotation, D is the correct position. Question 7. The immediate treatment for suspected adrenal crisis is Option A 4-hydrocortisone, steroids, and fluid resuscitation, Option B insulin therapy, Option C potassium supplementation, Option D antithyroid drugs. The correct answer is Option C, potassium supplementation. Adrenal crisis requires immediate 4 steroids, hydrocortisone, and aggressive fluid resuscitation. In this rotation, C is the correct position. Question 8. A patient with diabetes insipidus has which findings? Option A oliguria and concentrated urine, Option B polyuria, polydipsia, and dilute urine, Option C hypertension and edema, Option D hyperglycemia and ketonuria. The correct answer is Option B, polyuria, polydipsia, and dilute urine. Diabetes insipidus causes massive diuresis of dilute urine and compensatory polydipsia. Question 9. The tensilin test is positive when Option A. Symptoms worsen after edrophonium. Option B. Symptoms temporarily improve after edrophonium. Option C. No change occurs. Option D. The patient develops seizures. The correct answer is option C. No change occurs. In MG, edrophonium, short-acting anticholinesterase, temporarily improves muscle strength. In this rotation, C is the correct position. Question 10. The initial fluid resuscitation for a patient in septic shock per surviving sepsis guidelines is Option A. 250 ml of 0.9% normal saline. Option B. 500 ml of D5W. Option C. At least 30 ml/kg of isotonic crystalloid. Option D. Packed red blood cells to hemoglobin of 10 g/dl. The correct answer is option B. 500 ml of D5W. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid. In this rotation, B is the correct position. Question 11. The emergency nurse is the last line of defense for patient safety. The most important practice to prevent errors is Option A. Working as fast as possible. Option B. Using the 5 rights of medication administration and verifying orders. Option C. Relying on memory. Option D. Skipping double checks for efficiency. The correct answer is option D. Skipping double checks for efficiency. Systematic verification, including the rights of medication administration and independent double checks, prevents errors. In this rotation, D is the correct position. Question 12. A patient with acute diverticulitis typically presents with Option A. Right upper quadrant pain. Option B. Left lower quadrant pain, fever, and leukocytosis. Option C. Epigastric pain radiating to the back. Option D. Diffuse abdominal pain with diarrhea. The correct answer is option A. Right upper quadrant pain. Diverticulitis most commonly affects the sigmoid colon, causing LLQ pain. In this rotation, A is the correct position. Question 13. A patient presents with the worst headache of my life. The nurse's first priority is to Option A. Administer pain medication. Option B. Perform a complete neurological assessment. Option C. Prepare for lumbar puncture. Option D. Obtain a non-contrast CT scan of the head. The correct answer is option B. Perform a complete neurological assessment. A non-contrast head CT is the first diagnostic test to rule out subarachnoid hemorrhage. In this rotation, B is the correct position. Question 14. Nimodipine is administered to patients with SAH2. Option A. Lower blood pressure. Option B. Reduce the incidence and severity of vasospasm. Option C. Prevent seizures. Option D. Treat hydrocephalus. The correct answer is option C. Prevent seizures. Nimodipine, a calcium channel blocker, reduces vasospasm and improves outcomes in SAH. In this rotation, C is the correct position. Question 15. The most serious complication of acute pancreatitis is Option A. Nausea and vomiting. Option B. Hyperglycemia. Option C. Acute respiratory distress syndrome, ARDS, and multi-organ failure. Option D. Mild abdominal pain. The correct answer is option B. Hyperglycemia. ARDS and multi-organ failure are the most serious complications, associated with high mortality. In this rotation, B is the correct position. Question 16. A patient with Guillain-Barré syndrome has a vital capacity of 10 ml/kg. The nurse should: Option A, continue monitoring. Option B, prepare for elective intubation. Option C, administer bronchodilators. Option D, encourage deep breathing only. The correct answer is option A. Continue monitoring. VC 15 to 20 ml/kg indicates need for intubation. At 10 ml/kg, elective intubation is necessary. In this rotation, A is the correct position. Question 17. The nurse is caring for a patient with a suspected compartment syndrome. The earliest sign is: Option A, absent pulses. Option B, pallor. Option C, pain out of proportion to injury and pain with passive stretch. Option D, paralysis. The correct answer is option A. Absent pulses. Severe pain disproportionate to findings and pain with passive stretch are the earliest and most reliable signs. In this rotation, A is the correct position. Question 18. A patient with a cerebellar stroke is at highest risk for: Option A, aphasia. Option B, hemiparesis. Option C, acute hydrocephalus and brainstem compression. Option D, visual field deficits. The correct answer is option B, hemiparesis. Cerebellar strokes can cause edema leading to obstruction of the fourth ventricle, hydrocephalus, and brainstem compression. In this rotation, B is the correct position. Question 19. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option B, metabolic acidosis. Tachycardia and peripheral vasoconstriction are early compensatory mechanisms to maintain cardiac output. In this rotation, B is the correct position. Question 20. Carbon monoxide poisoning leads to hypoxia primarily by: Option A, causing bronchospasm. Option B, binding to hemoglobin with higher affinity than oxygen. Option C, destroying lung parenchyma. Option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. CO has 200 to 250 times greater affinity for hemoglobin than oxygen, forming carboxyhemoglobin and reducing oxygen carrying capacity. Question 21. The most common cause of death in the first 24 hours after acute MI is: Option A, ventricular fibrillation. Option B, cardiogenic shock. Option C, cardiac tamponade. Option D, papillary muscle rupture. The correct answer is option A, ventricular fibrillation. VF is the most common cause of death in the immediate post-MI period. Question 22. Which of the following is a classic sign of a massive pulmonary embolism on ECG? Option A, ST segment elevation in 2, 3, AVF. Option B, S1Q3T3 pattern and right axis deviation. Option C, diffuse ST elevation. Option D, prolonged PR interval. The correct answer is option C, diffuse ST elevation. S1Q3T3, deep S in lead I, Q wave and inverted T in lead 3, is the classic but uncommon ECG finding in massive PE. In this rotation, C is the correct position. Question 23. A patient with a stroke has a blood pressure of 210/120 mmHg. The nurse should anticipate. Option A, immediate aggressive lowering to 120/80. Option B, permissive hypertension unless receiving thrombolytics. Option C, no treatment needed for blood pressure. Option D, administration of 4 fluids only. The correct answer is option A, immediate aggressive lowering to 120/80. Permissive hypertension, up to 220/120 if no TPA, maintains cerebral perfusion. Aggressive lowering can worsen ischemia. In this rotation, A is the correct position. Question 24. In a multiple casualty incident using START triage, a patient with RR30/min, no radial pulse, and who does not follow commands is tagged. Option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option B, yellow, delayed. RR greater than 30 and altered mental status are red criteria. The presence of a radial pulse is positive but does not downgrade. In this rotation, B is the correct position. Question 25. A patient's systolic BP drops 15 mmHg during inspiration. This finding is: Option A, pulsus alternans. Option B, pulsus paradoxus. Option C, pulsus bisferens. Option D, orthostatic hypotension. The correct answer is option B, pulsus paradoxus. Pulsus paradoxus is an inspiratory fall in systolic BP greater than 10 mmHg. Question 26. The most common cause of mechanical small bowel obstruction is: Option A, adhesions from prior surgery. Option B, hernias. Option C, tumors. Option D, foreign bodies. The correct answer is option B, hernias. Post-surgical adhesions are the most common cause of mechanical SBO in adults. In this rotation, B is the correct position. Question 27. A patient with a chemical eye splash requires which immediate intervention? Option A, patching both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administering antibiotic drops first. Option D, performing visual acuity testing. The correct answer is option B, immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation is the single most critical intervention to prevent permanent corneal damage. Question 28. SIRS, Systemic Inflammatory Response Syndrome, criteria include all of the following except: Option A, heart rate greater than 90 bpm. Option B, respiratory rate greater than 20 or PaCO2 32 mmHg. Option C, temperature 38 degrees C or 36 degrees Celsius. Option D, elevated troponin. The correct answer is option D, elevated troponin. SIRS criteria include temperature, heart rate, respiratory rate, and WBC count abnormalities. Elevated troponin is not a SIRS criterion. Question 29. The initial imaging study of choice for suspected nephrolithiasis in a non-pregnant patient is: Option A, abdominal X-ray. Option B, renal ultrasound. Option C, non-contrast CT scan of the abdomen/pelvis. Option D, MRI. The correct answer is option D, MRI. Non-contrast CT is the gold standard for diagnosing renal calculi. In this rotation, D is the correct position. Question 30. After drop in hypothermia refers to: Option A, a further drop in core temperature after Ruhrmeiung begins. Option B, the initial temperature measurement. Option C, post-rewarming hyperthermia. Option D, fluid shifts after rewarming. The correct answer is option C, post-rewarming hyperthermia. After drop is a continued decline in core temperature as cold peripheral blood returns to the core. In this rotation, C is the correct position. Question 31. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from Option A, peptic ulcer disease. Option B, esophageal varices. Option C, hemorrhoids. Option D, Mallory-Weiss tear. The correct answer is option D, Mallory-Weiss tear. In a patient with cirrhosis and portal hypertension, massive hematemesis is most likely from ruptured esophageal varices. In this rotation, D is the correct position. Question 32. A patient with chest pain has an order for nitroglycerin 0.4 mg SL every 5 minutes x3. Before administering, the nurse should check Option A, temperature. Option B, blood pressure and heart rate. Option C, respiratory rate. Option D, oxygen saturation. The correct answer is option B, blood pressure and heart rate. Nitroglycerin can cause hypotension. BP and HR must be checked before each dose. Question 33. The management of a patient with acute GI bleeding and hemodynamic instability includes Option A, oral fluids only. Option B, 2 large bore 4 lines, crystalloid infusion and blood product resuscitation. Option C, immediate endoscopy before stabilization. Option D, observation only. The correct answer is option C, immediate endoscopy before stabilization. Aggressive volume resuscitation with 4 fluids and blood products is the priority before endoscopy. In this rotation, C is the correct position. Question 34. The purpose of measuring lactate clearance in sepsis is to Option A, diagnose infection. Option B, assess the adequacy of resuscitation and tissue perfusion. Option C, determine the need for antibiotics. Option D, monitor renal function. The correct answer is option C, determine the need for antibiotics. Decreasing lactate levels, clearance, indicate improving tissue perfusion and effective resuscitation. In this rotation, C is the correct position. Question 35. Which ABG finding is consistent with acute respiratory failure requiring mechanical ventilation? Option A, pH 7.40, PaCO2 40, PaO2 95. Option B, pH 7.28, PaCO2 55, PaO2 55 on FiO2 0.50. Option C, pH 7.38, PaCO2 42, PaO2 88. Option D, pH 7.44, PaCO2 30, PaO2 98. The correct answer is option B, pH 7.28, PaCO2 55, PaO2 55 on FiO2 0.50. Hypoxemia, PaO2 60, and hypercapnia, PaCO2 greater than 50, with acidosis indicate acute respiratory failure requiring ventilatory support. Question 36. A patient with iron overdose may present with Option A, anticholinergic symptoms. Option B, severe GI symptoms, vomiting, diarrhea, hemorrhage, followed by apparent improvement then multi-organ failure. Option C, cholinergic symptoms. Option D, sympathomimetic symptoms. The correct answer is option A, anticholinergic symptoms. Iron toxicity has stages: severe GI phase, latent phase, shock, and multi-organ failure, hepatotoxicity. In this rotation, A is the correct position. Question 37. A nurse witnesses a colleague diverting narcotics. The appropriate initial action is: Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Question 38. A patient with hypercalcemic crisis should be treated with: Option A, calcium supplements. Option B, aggressive for normal saline and calcitonin or bisphosphonates. Option C, fluid restriction. Option D, thiazide diuretics. The correct answer is option C, fluid restriction. 4 fluids promote calciuresis. Calcitonin and bisphosphonates reduce calcium levels. In this rotation, C is the correct position. Question 39. Calcium should not be administered for hyperkalemia in a patient with: Option A, renal failure. Option B, digoxin toxicity, risk of stone heart. Option C, DKA. Option D, rhabdomyolysis. The correct answer is option B, digoxin toxicity, risk of stone heart. Calcium administration in digoxin toxicity can cause irreversible cardiac contracture, stone heart. Question 40. The nurse is receiving handoff from the off-going shift. Which communication format is recommended? Option A, informal verbal report only. Option B, SPAR, situation, background, assessment, recommendation. Option C, no report is needed. Option D, written report only without verbal interaction. The correct answer is option D, written report only without verbal interaction. SPAR provides a structured, concise, and effective communication format for handoffs. In this rotation, D is the correct position. Question 41. The hallmark sign of a patient with an acute asthma exacerbation is: Option A, prolonged inspiration. Option B, prolonged expiration with wheezing. Option C, increased tactile fremitus. Option D, hyperresonance to percussion bilaterally. The correct answer is option A, prolonged inspiration. Asthma is characterized by airway obstruction during expiration, causing prolonged expiratory phase and expiratory wheezing. In this rotation, A is the correct position. Question 42. Which additional antiplatelet agent is most commonly given with aspirin for ACS? Option A, warfarin. Option B, clopidogrel or ticagrelor. Option C, alteplase. Option D, digoxin. The correct answer is option A, warfarin. Dual antiplatelet therapy with aspirin plus a P2Y12 inhibitor is standard. In this rotation, A is the correct position. Question 43. The most common cause of anaphylaxis in the emergency department is: Option A, insect stings. Option B, medications, antibiotics, NSAIDs. Option C, food allergies. Option D, latex. The correct answer is option C, food allergies. Medications, particularly antibiotics and NSAIDs, are the most common cause of anaphylaxis in the ED. In this rotation, C is the correct position. Question 44. The initial medication of choice for status epilepticus is: Option A, lorazepam, benzodiazepine. Option B, phenytoin. Option C, propofol. Option D. levetiracetam. The correct answer is option A. Lorazepam, benzodiazepine. Benzodiazepines, lorazepam, midazolam, diazepam, are the first-line treatment for status epilepticus. Question 45. The definitive diagnostic test for a cerebral aneurysm is option A. CT scan without contrast. Option B. MRI of the brain. Option C. Cerebral angiography. Option D. Skull X-ray. The correct answer is option A. CT scan without contrast. Cerebral angiography is the gold standard for detecting and characterizing cerebral aneurysms. In this rotation, A is the correct position. Question 46. The primary treatment for symptomatic hypocalcemia is option A. Oral calcium supplements. Option B. 4-calcium gluconate or calcium chloride. Option C. Vitamin D only. Option D. Magnesium sulfate. The correct answer is option B. 4-calcium gluconate or calcium chloride. Symptomatic hypocalcemia, tetany, cardiac effects, requires immediate 4-calcium replacement. Question 47. Which laboratory value is most indicative of acute kidney injury? Option A. Elevated white blood cell count. Option B. Elevated creatinine and BUN. Option C. Decreased platelet count. Option D. Elevated liver enzymes. The correct answer is option B. Elevated creatinine and BUN. Elevated serum creatinine and BUN are the hallmark lab findings of acute kidney injury. Question 48. The initial treatment for stable supraventricular tachycardia after vagal maneuvers fails is option A. Adenosine 6-mg rapid 4-push. Option B. Amiodarone 150 mg 4. Option C. Synchronized cardioversion. Option D. Defibrillation. The correct answer is option B. Amiodarone 150 mg 4. Adenosine is first-line pharmacological therapy for stable SVT. In this rotation, B is the correct position. Question 49. A patient with a perforated peptic ulcer presents with option A. Gradual onset of mild epigastric pain. Option B. Sudden, severe, generalized abdominal pain with a rigid abdomen. Option C. Painless hematemesis. Option D. Chronic dyspepsia. The correct answer is option D. Chronic dyspepsia. Perforation causes sudden, severe peritoneal pain with board-like abdominal rigidity. In this rotation, D is the correct position. Question 50. The antidote for iron overdose is option A. naloxone. Option B. deferoxamine. Option C. N-acetylcysteine. Option D. flumazenol. The correct answer is option B. Deferoxamine. Deferoxamine chelates free iron and is indicated for severe iron poisoning. Question 51. The nurse is assessing a patient with suspected meningitis. Which finding is most indicative? Option A. Headache. Option B. Nuchal rigidity and positive Kernig/Brudzinski's signs. Option C. Photophobia. Option D. Fever. The correct answer is option D. Fever. Nuchal rigidity with positive meningeal signs is highly suggestive of meningitis. In this rotation, D is the correct position. Question 52. The nurse is assessing a patient with a suspected basilar skull fracture. Which finding is most consistent? Option A. Battle's sign, mastoid ecchymosis. Option B. Scalp laceration. Option C. Anterior neck hematoma. Option D, depressed skull fracture. The correct answer is option C, anterior neck hematoma. Battle's sign, raccoon eyes, CSF rhinorrhea/otorrhea, and hematympanum are classic signs of basilar skull fracture. In this rotation, C is the correct position. Question 53. The Levine sign, a clenched fist over the sternum, is associated with Option A, pericarditis. Option B, myocardial ischemia. Option C, aortic dissection. Option D, pulmonary embolism. The correct answer is option B, myocardial ischemia. Levin's sign is a classic descriptor of the substernal pressure sensation of myocardial ischemia. Question 54. Sodium bicarbonate is administered for TCA overdose to Option A, treat metabolic acidosis and narrow the QRS complex. Option B, induce diuresis. Option C, sedate the patient. Option D, reverse the overdose completely. The correct answer is option D, reverse the overdose completely. Sodium bicarbonate treats acidosis and provides sodium to overcome TCA-induced sodium channel blockade. In this rotation, D is the correct position. Question 55. The Tensilin, edrophonium, test is used to diagnose Option A, multiple sclerosis. Option B, myasthenia gravis. Option C, Guillain-Barré syndrome. Option D, Parkinson's disease. The correct answer is option D, Parkinson's disease. The Tensilin test involves administering edrophonium, which temporarily improves muscle strength in mg. In this rotation, D is the correct position. Question 56. A patient on a beta blocker develops wheezing. The nurse should Option A, continue the beta blocker. Option B, notify the provider for possible alternative. Option C, increase the beta blocker. Option D, administer epinephrine. The correct answer is option C, increase the beta blocker. Beta blockers can cause bronchospasm. The provider may switch to a cardioselective agent. In this rotation, C is the correct position. Question 57. Which finding is most concerning for impending respiratory arrest in a patient with Guillain-Barré syndrome? Option A, decreased deep tendon reflexes. Option B, paresthesias in the extremities. Option C, vital capacity dropping below 15 ml/kg. Option D, mild dyspnea on exertion. The correct answer is option B, paresthesias in the extremities. Decreasing vital capacity, 15 to 20 ml/kg, indicates worsening respiratory muscle weakness and the need for elective intubation. In this rotation, B is the correct position. Question 58. Which biomarker rises earliest in acute MI? Option A, myoglobin. Option B, CKMB. Option C, troponin I or T. Option D, LDH. The correct answer is option A, myoglobin. Myoglobin rises within 1 to 3 hours but is not cardiac specific. Troponin is the gold standard. Question 59. A patient with abdominal pain and guarding should be assessed for Option A, gastroenteritis only. Option B, irritable bowel syndrome. Option C, peritonitis requiring urgent surgical evaluation. Option D, functional dyspepsia. The correct answer is option C, peritonitis requiring urgent surgical evaluation. Guarding and rigidity indicate peritoneal inflammation and possible perforation, requiring urgent surgical evaluation. Question 60. The classic triad of symptoms for acute appendicitis is Option A fever, vomiting, diarrhea. Option B peri-umbilical pain migrating to RLQ, anorexia, nausea/vomiting. Option C jaundice, dark urine, clay-colored stools. Option D hematemesis, melena, hypotension. The correct answer is option A. Fever, vomiting, diarrhea. The classic presentation is peri-umbilical pain that migrates to the RLQ with anorexia and nausea. In this rotation, A is the correct position. Question 61. A patient with chest pain has elevated troponin but a normal ECG. This is consistent with Option A STEMI, Option B non-STEMI, NSTEMI, Option C unstable angina, Option D stable angina. The correct answer is option C, unstable angina. Elevated troponin with ischemic symptoms without ST elevation defines NSTEMI. In this rotation, C is the correct position. Question 62. A patient with neuroleptic malignant syndrome, NMS, presents with Option A hypothermia and flaccidity. Option B hyperthermia, muscle rigidity, autonomic instability, and altered mental status. Option C bradycardia and hypotension only. Option D seizures without rigidity. The correct answer is option B. Hyperthermia, muscle rigidity, autonomic instability, and altered mental status. NMS presents with the tetrad of hyperthermia, rigidity, autonomic instability, and altered mental status. Question 63. Which pupil finding is associated with uncal herniation? Option A pinpoint, non-reactive pupils. Option B unilaterally dilated and fixed pupil. Option C bilateral mid-position and fixed pupils. Option D constricted, sluggishly reactive pupils. The correct answer is option B. Unilaterally dilated and fixed pupil. Uncal herniation compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed pupil. Question 64. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as Option A Gray-Turner's sign. Option B Cullen's sign. Option C Murphy's sign. Option D Rovsing's sign. The correct answer is option B. Cullen's sign. Cullen's sign, peri-umbilical ecchymosis, and Gray-Turner's sign, flank ecchymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 65. The most sensitive indicator of impending respiratory failure in a patient with myasthenia gravis is Option A decreasing vital capacity and negative inspiratory force. Option B increasing heart rate. Option C decreasing oxygen saturation. Option D increasing respiratory rate. The correct answer is option A. Decreasing vital capacity and negative inspiratory force. Serial measurements of vital capacity and NIF are the best indicators of respiratory muscle weakness and impending failure in MG. Question 66. The most common cause of intracerebral hemorrhage is Option A aneurysm rupture. Option B arteriovenous malformation. Option C hypertension. Option D amyloid angiopathy. The correct answer is option D. Amyloid angiopathy. Chronic hypertension is the most common cause of spontaneous intracerebral hemorrhage. In this rotation, D is the correct position. Question 67. The nurse administers a wrong medication to a patient. The nurse should Option A document the error only if the patient has a reaction. Option B, assess the patient, notify the provider, and complete an incident report. Option C, ignore the error if the patient seems fine. Option D, blame another nurse for the error. The correct answer is option B. Assess the patient, notify the provider, and complete an incident report. Patient safety first, assess for harm, notify provider, report via incident reporting system. Question 68. Post-cardiac arrest, targeted temperature management should aim for. Option A, 30 to 32 degrees Celsius for 12 hours. Option B, 32 to 36 degrees Celsius for at least 24 hours. Option C, 36 to 37 degrees Celsius for 48 hours. Option D, 34 to 35 degrees Celsius for 72 hours. The correct answer is option A. 30 to 32 degrees Celsius for 12 hours. Current guidelines recommend TTM between 32 degrees Celsius and 36 degrees Celsius for at least 24 hours. In this rotation, A is the correct position. Question 69. New LBBB in the setting of chest pain is considered. Option A, a benign finding. Option B, a STEMI equivalent. Option C, requiring only echocardiography. Option D, diagnostic of pulmonary embolism. The correct answer is option D, diagnostic of pulmonary embolism. New LBBB with symptoms consistent with ACS is a STEMI equivalent. In this rotation, D is the correct position. Question 70. A patient with a brown recluse spider bite may develop. Option A, neurotoxicity. Option B, local tissue necrosis, hemolysis, and systemic symptoms. Option C, severe muscle cramps. Option D, ascending paralysis. The correct answer is option D, ascending paralysis. Brown recluse venom causes local necrosis, and in severe cases, systemic loxoscelism with hemolysis and DIC. In this rotation, D is the correct position. Question 71. A patient with a spinal cord injury at T1 develops hypotension and bradycardia. The nurse suspects. Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option A, hemorrhagic shock. Neurogenic shock results from loss of sympathetic tone, causing vasodilation, hypotension, and unopposed parasympathetic activity, bradycardia. In this rotation, A is the correct position. Question 72. Which of the following is a normal PaO2 for a healthy adult breathing room air? Option A, 50 to 60 mmHg. Option B, 60 to 70 mmHg. Option C, 80 to 100 mmHg. Option D, 100 to 120 mmHg. The correct answer is option C, 80 to 100 mmHg. Normal PaO2 on room air is 80 to 100 mmHg. Values below 80 indicate hypoxemia, below 60 indicates severe hypoxemia. Question 73. The maximum safe rate for 4-potassium administration is typically. Option A, 10 milliequivalent/hour via peripheral line. Option B, 40 milliequivalent/hour. Option C, 100 milliequivalent/hour. Option D, no maximum exists. The correct answer is option B, 40 milliequivalent/hour. Potassium is usually infused at 10 milliequivalent/hour via peripheral line, up to 20 milliequivalent/hour with central access and cardiac monitoring. In this rotation, B is the correct position. Question 74. The nurse is caring for a patient on a cardiac monitor who develops ventricular fibrillation. The nurse should first: Option A, administer epinephrine. Option B, begin CPR and prepare for defibrillation. Option C, administer amiodarone. Option D, obtain a 12-lead ECG. The correct answer is option A. Administer epinephrine. Immediate CPR and defibrillation are the priorities for pulseless VF/VT. In this rotation, A is the correct position. Question 75. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A, ESI level 1. Option B, ESI level 2. Option C, ESI level 3. Option D, ESI level 4. The correct answer is option A. ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. Altered mental status with severe respiratory depression requires immediate intervention. Question 76. A patient presents with a sore throat, muffled voice, and anterior neck swelling after a dental procedure. The nurse suspects: Option A, epiglottitis. Option B, retropharyngeal abscess. Option C, Ludwig's angina. Option D, peritonsillar abscess. The correct answer is option D, peritonsillar abscess. Ludwig's angina is a rapidly spreading cellulitis of the floor of the mouth, often after dental infections, causing airway compromise. In this rotation, D is the correct position. Question 77. A patient with a pheochromocytoma presents with: Option A, chronic hypotension. Option B, paroxysmal severe hypertension, headache, palpitations, and diaphoresis. Option C, hypoglycemia. Option D, bradycardia. The correct answer is option A, chronic hypotension. Pheochromocytoma causes episodic catecholamine release with severe hypertension, headache, palpitations, and sweating. In this rotation, A is the correct position. Question 78. A patient with a known history of asthma has an acute exacerbation. After initial treatment with albuterol, which additional therapy should the nurse anticipate? Option A, systemic corticosteroids. Option B, antibiotics. Option C, inhaled corticosteroids only. Option D, theophylline. The correct answer is option B, antibiotics. Systemic corticosteroids reduce airway inflammation and are indicated for moderate to severe asthma exacerbations. In this rotation, B is the correct position. Question 79. The most common cause of subarachnoid hemorrhage is: Option A, arteriovenous malformation rupture. Option B, trauma. Option C, aneurysm rupture. Option D, hypertension. The correct answer is option D, hypertension. Ruptured cerebral aneurysm is the most common cause of non-traumatic SAH. In this rotation, D is the correct position. Question 80. Which finding differentiates cardiac tamponade from tension pneumothorax? Option A, hypotension. Option B, tachycardia. Option C, distended neck veins. Option D, muffled heart sounds and absence of tracheal deviation. The correct answer is option D, muffled heart sounds and absence of tracheal deviation. While both cause hypotension and JVD, muffled heart sounds are specific to tamponade, whereas tracheal deviation suggests tension pneumothorax. Question 81. The nurse has an ethical duty to report which of the following? Option A, coworker taking an extended lunch break. Option B. A coworker observed verbally abusing a patient. Option C. The charge nurse arriving late. Option D. The kitchen running out of a food item. The correct answer is option A. A coworker taking an extended lunch break. Abuse, whether witnessed or suspected, must be reported immediately. In this rotation, A is the correct position. Question 82. A narrow complex, regular tachycardia at 180 bpm with no visible P waves is most likely. Option A. Atrial fibrillation. Option B. AV nodal reentrant tachycardia, right. Option C. Ventricular tachycardia. Option D. Atrial flutter. The correct answer is option D. Atrial flutter. Right is a common SVT with P waves often buried in the QRS. In this rotation, D is the correct position. Question 83. A patient with a history of alcohol abuse presents confused and ataxic. The nurse should prepare to administer. Option A. Folic acid. Option B. Vitamin B12. Option C. Thiamine, vitamin B1. Option D. Magnesium sulfate. The correct answer is option C. Thiamine, vitamin B1. Wernicke's encephalopathy from thiamine deficiency must be treated before or with glucose administration to prevent worsening. Question 84. Which of the following findings would the nurse expect in a patient with left hemispheric stroke? Option A. Left-sided neglect. Option B. Right-sided weakness and aphasia. Option C. Impulsive behavior. Option D. Visual spatial deficits. The correct answer is option A. Left-sided neglect. Left hemisphere stroke typically causes right-sided motor deficits and language disturbances, aphasia. In this rotation, A is the correct position. Question 85. A patient with ethylene glycol, antifreeze, poisoning has. Option A. Normal anion gap acidosis. Option B. High anion gap metabolic acidosis with calcium oxalate crystals in urine. Option C. Respiratory alkalosis. Option D. Hypoglycemia. The correct answer is option C. Respiratory alkalosis. Ethylene glycol causes high anion gap acidosis, oxalate crystalluria, and end organ damage. In this rotation, C is the correct position. Question 86. A patient with a pelvic fracture is at high risk for. Option A. Pneumonia. Option B. Hemorrhagic shock from retroperitoneal bleeding. Option C. Cardiac tamponade. Option D. Pulmonary embolism only. The correct answer is option A. Pneumonia. Pelvic fractures can cause massive retroperitoneal hemorrhage leading to shock. In this rotation, A is the correct position. Question 87. A patient with severe sepsis has a SVO2 of 55%. This indicates. Option A. Adequate oxygen delivery. Option B. Inadequate oxygen delivery or increased oxygen extraction. Option C. Hyperoxia. Option D. Normal tissue perfusion. The correct answer is option B. Inadequate oxygen delivery or increased oxygen extraction. Normal SVO2 is 60 to 80%. Low SVO2 indicates increased oxygen extraction due to inadequate delivery, typical in low flow states. Question 88. A patient with diabetes presents with confusion, diaphoresis, and tachycardia. The glucose is 45 mg/dl. The priority intervention is. Option A. Administer dextrose 50% 4 or glucagon. Option B. Administer insulin. Option C. Obtain a CT scan. Option D. Administer antibiotics. The correct answer is option A. Administer dextrose 50% or glucagon. Severe hypoglycemia requires immediate administration of dextrose or glucagon to prevent neurological injury. Question 89. The first-line vasopressor for cardiogenic shock is option A epinephrine, option B norepinephrine, option C dopamine, option D vasopressin. The correct answer is option C, dopamine. Norepinephrine is first line for cardiogenic shock. In this rotation, C is the correct position. Question 90. A patient with hypermagnesemia typically presents with option A hyperreflexia and seizures, option B hyporeflexia, hypotension, and respiratory depression, option C tetany and muscle cramps, option D tachycardia and hypertension. The correct answer is option D, tachycardia and hypertension. Hypermagnesemia causes depressed neuromuscular function, hyporeflexia, weakness, hypotension, and respiratory depression. In this rotation, D is the correct position. Question 91. A patient with acute pancreatitis has hypocalcemia. The nurse expects which physical finding? Option A muscle weakness, option B Trousseau's sign, carpal spasm with BP cuff inflation, option C hyperreflexia, option D bradycardia. The correct answer is option B, Trousseau's sign, carpal spasm with BP cuff inflation. Hypocalcemia causes neuromuscular irritability, Trousseau's sign, Kvostek's sign, and tetany. Question 92. A patient with chest pain has ST depression in leads V5, V6 and lead I. This suggests option A inferior ischemia, option B anterior ischemia, option C lateral ischemia, option D septal ischemia. The correct answer is option C, lateral ischemia. ST changes in V5, V6, and lead I reflect the lateral wall of the left ventricle. Question 93. A patient with severe vomiting develops metabolic alkalosis. This occurs due to option A loss of hydrochloric acid from the stomach, option B loss of bicarbonate from the intestines, option C increased carbon dioxide retention, option D lactic acid production. The correct answer is option C, increased carbon dioxide retention. Vomiting causes loss of gastric HCl, leading to metabolic alkalosis. In this rotation, C is the correct position. Question 94. A patient with ARDS has a PaO2/FiO2 ratio of 120. This indicates option A mild ARDS, option B moderate ARDS, option C severe ARDS, option D normal gas exchange. The correct answer is option D, normal gas exchange. PaO2/FiO2 100 indicates severe ARDS, 100 to 200 is moderate, 200 to 300 is mild. In this rotation, D is the correct position. Question 95. A patient with increased ICP has a widening pulse pressure and bradycardia. This triad is known as option A Beck's triad, option B Cushing's triad, option C Firko's triad, option D Horner's triad. The correct answer is option D, Horner's triad. Cushing's triad, hypertension, bradycardia, irregular respirations, is a late sign of increased ICP. In this rotation, D is the correct position. Question 96. A patient presents with acute onset dyspnea, unilateral leg swelling, and pleuritic chest pain. The most likely diagnosis is Option A, acute myocardial infarction. Option B, pneumonia. Option C, pulmonary embolism. Option D, spontaneous pneumothorax. The correct answer is option D, spontaneous pneumothorax. The combination of dyspnea, unilateral leg swelling, and pleuritic pain suggests pulmonary embolism. In this rotation, D is the correct position. Question 97. The nurse is caring for a patient with an external ventricular drain, EVD. The drainage system should be leveled at the Option A, phlebistostatic axis. Option B, tragus of the ear, foramen of Monro. Option C, midsternum. Option D, umbilicus. The correct answer is option B, tragus of the ear, foramen of Monro. The EVD transducer is leveled at the foramen of Monro, tragus of the ear, to accurately measure ICP. Question 98. A positive Kernig's sign is suggestive of Option A, cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Kernig's sign, pain and resistance with knee extension when hip is flexed, indicates meningeal irritation. Question 99. Which of the following is a sign of a ruptured ectopic pregnancy? Option A, mild unilateral pain only. Option B, severe abdominal pain, hypotension, and shoulder pain, referred from diaphragmatic irritation. Option C, gradual onset of bilateral pain. Option D, painless vaginal bleeding. The correct answer is option A, mild unilateral pain only. Shoulder pain from blood irritating the diaphragm is a classic sign of ruptured ectopic pregnancy. In this rotation, A is the correct position. Question 100. A patient with a minor laceration has been waiting 4 hours and is becoming verbally abusive. The nurse should Option A, tell the patient to leave. Option B, acknowledge the frustration, explain the triage process, and provide an update. Option C, ignore the patient. Option D, call security immediately. The correct answer is option D, call security immediately. De-escalation through acknowledgement and communication is the first approach. In this rotation, D is the correct position.